Hello everybody, Luke Gordon, physical therapist, back with another video on total knee replacement surgery and how to make the best recovery you can as quickly as possible. The question I want to address today is, how frequently should you be doing physical therapy? Now, I kind of alluded to this in my last video that I just made, which was about should you be getting hands-on treatment. I'm just going to go a little more in depth on this one. And the lens that I kind of threw in to that last video was, you're probably watching this and you're like a regular person, right? You're somebody's mom, you're somebody's daughter, son, uncle, whatever you are. You're just kind of like me though. You're a normal person, you had surgery. So you're going to expect like normal treatment, right? And so that will probably be, you're going to go into PT twice a week, maybe 3 times a week, something like that. But again, if we challenge our thinking a little bit on this one, let's say you're a special person. Let's say you're a surgeon, or you're a really high-end corporate CEO, or you're a professional athlete, right? You're like the most important people on the planet then. And I like that lens. It's like, well, how often would you be going to PT if you were a professional athlete? And the answer there is you would be going to PT 7 days a week. And they would be doing everything they could to maximize your recovery, which goes back to my previous video about they would be doing massage on you. They would be doing manual techniques, all those things. I won't go into detail on that, but if you didn't see that video, I'll pop it up here. It was a pretty good one, I thought. But so again, the topic of this video is how often should you be going to PT. My best advice is that you should be going 3 times a week, especially if you've just had therapy and you've got pain and swelling and things like that, and your therapist should be doing everything they can to help you get the pain down, get the swelling down, make sure you're doing your stretches and exercises correctly. But I think for a lot of people, as long as it doesn't interfere with your schedule, more is better with PT. So it's easy for us to default to just twice a week, you know, for however many weeks. But I think really, especially within that first month, you know, when your window of opportunity is wide open in terms of getting your swelling and pain down and getting your range of motion and strength to go up as quickly as possible, I think you should be going into PT more frequently rather than less frequently. And again, if you were a really important person, we might just have, and you have a lot of swelling, let's say, we might just have you coming into PT every day. So I'm challenging my own thinking a little bit on that too, and hopefully challenging yours. So if you feel like you need more PT and twice a week just isn't enough, maybe talk to your PT or your doctor and say, can we bump it to 3-4 times a week? One last idea that I'm going to throw into this video too is that during COVID, we really didn't have access to our aquatic therapy program, because it was located off-site at an assisted living facility. Everything's super locked down in our state. So anyhow, we got that back now. And so we're trying to kind of, I think, reimagine that too, as like, if you're a total knee client and you can either cover your incision safely to minimize infection risk, or you're at the point where your incision is fully healed, you probably should be getting into aquatic therapy too, because there's some pretty good research that shows that people that do aquatic therapy have better outcomes than people that don't. And there's different reasons for that. I think one of the big reasons is that in an aquatic environment, you can move so freely, but then also the deeper you get your leg and your knee into the water, the more of a pressure gradient you have to start pushing that swelling back up the leg again, towards the groin, towards your core, back to where it can be reabsorbed by your whole system. So again, challenge your thinking a little bit. Maybe if you're not making as much progress as you want to, maybe you should be going to PT more frequently, or going again back to that last video I made, maybe you should find a PT who's really good with their hands and who will get rid of your swelling, or they specialize in like lymphedema or swelling reduction, or they specialize in myofascial release or strain counter strain or instrument assisted types of massage, and they can add something that you can't do on your own. So that's the video for today. If you think you need more PT, I might just tend to agree with you on that. Go more frequently rather than less. Come from that viewpoint that you are a very important person, and realistically, the faster you can regain full motion in your knee, the faster you can regain full strength in your knee, and you can get rid of that pain and stiffness and swelling, the better off your life is going to be for several years to come, hopefully decades to come. So that's the message. Thank you for watching. If you liked it, please leave me a thumbs up. Please subscribe before you go, and I would love to hear from you in the comment section below. That's it for today. Thank you.